right.
Yeah, go right.
All right. Works. All right. First, I'm not a PhD. I'm not a doctor. I'm not a scientist. My background is I'm a for-hire CEO for venture capital, private equity, and I take technology to either spin them out, grow them, or turn them around when they're failing. And so you'll see why our deck looks the way that it does. I'm not going to go deep into the science. I might be able to, but I don't want to get over my skis here. What I do want to talk about is something very personal. This technology, the reason I'm here today is this technology saved my daughter's life. I was the proud parent of a daughter whose personality changed over the course of her sophomore year of high school from very extroverted, happy to introverted, sad, failing out of school, lost her friend groups, and was effectively not leaving her bedroom 5 to 6 days a week, crying every day. We took her to multiple institutions, multiple doctors, psychiatry. I had access to the best at Stanford, UCLA, you name it. I've been there with her. They all said, your daughter's an unhappy little child and she'll grow through this. Doesn't make sense. She was a very happy child. Everything changed suddenly. But I didn't know what that point in time was until I met this technology. And I was doing a workout for a family out of LA, big family office, and stumbled into this. And what I saw with my daughter is what we experience in the mental health care field is that there's too many patients, there's not enough access, there's subjective data sets. Data doesn't necessarily correlate or aggregate or create the ability to create directional trends. And in sitting with a scientist for 10 minutes, he placed an EEG cap on my daughter's head, stepped out of the room and said, your daughter ever have a concussion, a traumatic brain injury? I said, she played competitive soccer, maybe. Asked my wife 2 years before she had an injury where she'd knocked herself out cold for an extended period of time. Her brain slowed to 7.5 cycles in the frontal lobe, never sped back up. The rest of her brain globally is about 10.5 hertz. She couldn't process the environment she was living in. No one told me that. They gave me pills, gave me a lot of talk therapy, asked me how I was feeling, asked her how she was feeling. But ultimately, the cost of that was she lost 1.5 years of her life and almost ended her life. So when I met this technology, I said, in 10 minutes, you can tell me more about my daughter than any physician I've met with or any institution I've been to has been able to tell me in the 1.5 years prior. I said, something needs to change. The cost of healthcare, you could argue, is too low or too high, depending on which side of the fence you're sitting on. The standard of care is certainly imprecise. And for me, I wanted to make a difference. And I said, you know, at that point, if you'll have me, I'll recapitalize this company. We'll raise money. We'll go and figure out how to do this best. We will focus on both science, rigorous science, publishing, FDA level research and trials, but also I want to test it because I believe that the markets tell us where we need to go and they tell us how to get there if you really listen closely. If you go back to the beginning of psychiatry, Sigmund Freud area, right? It's feelings, how do you feel? Tell me how you feel, and I'll tell you why I think you feel the way you do. And if I have a good therapist and I refer you to my therapist, she'll probably have a good therapist. But if you don't have access to one, that's a limiting capability. Then we went into the pill therapies, and like STAR-D broke through the norms and kind of set the bar very high. You're seeing a lot of publications recently kind of debunking some of the findings there. If 1 pill's good, 2 pills are probably better, 3 pills will probably get you to a better spot. And not really sure if that's the reality or not. Again, not a scientist. I wish I could go back and relive my life over because I would really dive deep into this area. But what we do know about what I call mental health care 3.0 is that if we can get to the first order principles, if we can get to neuron function, we can see dysfunction, then we could probably understand how somebody's experiencing life. We could probably wrap around other therapies that would be more helpful to them. And a combination of all modalities could produce a more curative effect faster. What we do at Wave is we are a SaaS company. We're hardware agnostic. We work with EEG, we work with TMS. We also work with a number of other neuromodulation technologies. We typically like to be somewhere in the 21 leads because we like spatial recognition when we talk about EEG, and we focus on the default mode network. So triple network theory, some people think salient, some people think default mode. We are resting state default mode network. And we learn to understand the disruptions and how they correlate to different illnesses. And so the first time we believe in the history of mental health is there's a objective biomarker platform that can guide mental health journeys to a curative endpoint with a stated endpoint in mind, which has traditionally been not the norm. What you're seeing here for the first time, hopefully, unless our deck's made it out further because we've done a lot of fundraising, is visualization of what mental illness could look like based off of alpha frequency degradation or deterioration based off a 10-minute eyes closed EEG. We have performed close to 100,000 EEGs with clinical scales correlated to the outcomes. So we see the EEG changes and we also see the clinical scale changes. And we also have been able to develop a pretty interesting and precise avatar of what mental illness looks like in its varying degrees, and leads us to the opportunity to create more curative outcomes using TMS. And so we use a standard EEG, doesn't matter, we don't care. We like high fidelity EEG signals, so we don't use the cheapest stuff. We like spatial recognition, so we use multiple channels. We like posterior leads, or some move away from that. Our chief science officer is Dr. Leslie Pritchett, who's arguably credited with creating the quantitative EEG out of NYU with her husband, Roy Johns. Right? She helps us understand EEG signal in ways that we otherwise probably would not. We create interesting reports and protocols, and we drive those via the cloud to TMS devices. We're fully integrated with 3 of the largest TMS devices on market, soon to be the 4th, which is the publicly traded Neurotech device. And then there's some we choose not to work with based off of the origin of the materials that they're using, and just presents problems for us because we do a lot of work with the military by way of our business. So we're on a parallel path. We're in an interesting place where science will kind of poke at us because we are pre-FDA, but yet we're commercial. We are sponsored in 5 states. 6th and 7th state will come on in Q1. We have an N of over 2,000. If you look at the data on the row, the column, sorry, on the left, you'll see the N, and you'll see the reduction in symptoms recorded by clinical scales. We average about 60% reduction in symptoms. The beauty of this technology, and I talk about scale of data and being able to use data to drive innovation. Typically, most technology has to have strong data inputs to be able to innovate and grow. These treatments are done in different facilities by different providers in different states. The only thing that's common to all of these treatments is our technology, which is both assessing the EEG and providing the protocol for treatment. You'll see how we relate to some of the pill therapies or standard TMS. We have elected to not go head-to-head with standard TMS because it doesn't expand the market, but we have a pretty good idea of how we'll do if we did go head-to-head with TMS. And I imagine that's going to be one of the next trials that we do. To date, I say I focus on commercial because the markets will tell you a lot. We are over 10 million of recurring revenue, annualized recurring revenue, 150 locations globally, 110,000 EEGs, 500,000 treatment sessions completed without one adverse event. We are profitable. We are pre-FDA, although we've received breakthrough designation on our device in our first double-blind RCT with the N of 156 completed about a month and a half ago. We'll be submitting within the next 2 to 3 weeks to the FDA. We know what our top line looks like. I can't share that, but we're submitting. So I'll give you a pretty good indication of how it went. We have a number of clinical research sites. The technology was really founded in the use of working with Military Special Operations Command. They paid for the first half of our FDA trial because of the results we got with at-risk populations coming out of the Navy SEALs, Deltas, and Rangers. And so we took that and we built this system. We gave it to physicians and said, use it how you will. And just like the last lady who was speaking about autism spectrum disorder and the lack of resources in that area, doctors applied it to that. Again, we don't treat patients. We make software that derives interesting data and creates protocols to help them more effectively use TMS devices. And typically we see better outcomes with TMS devices as a result of that. But 30% of the time physicians are using it for autism, which is mind blowing. Never set out to do that. Tells you about the need out there and what people are willing to do. Today, 90% of our business that our physicians are doing is off-label, fee for service. People are willing to pay for better results. People are not willing to wait for the institutions to ramp up and improve the technologies at the rate that the technologies are being innovated. And all of our treatments are done at 50% of motor threshold with precision guidance to the alpha frequency, unlike the FDA approval, which is 120% of motor threshold and a static 10 hertz frequency. So we've proven the commercial model. We have great retention, 98% retention of our clients. The business is growing. We grow at about 50% per year. No advertising or marketing yet. And after our FDA clearance, we plan to do that. So WaveNeuroscience, check it out if you want to talk science, if you want to do research together, if you want to debate the science. I'm all about making sure that when we are done, we've created a platform that aggregates data, allows people to feed into it, mine it, use it for innovation, accelerate technologies, and get people to more curative endpoints faster. With the number one reason I first got into it is to reduce the pain, shame, and suffering that is currently the mental health process as we know it today. Thank you for your time.
All right. Great talk. Any questions for Fred? Fred, let me ask you, do you have intentions of rolling this out as something you could license or franchise to practitioners or in other geographical areas?
Yeah, so our goal is to ensure that everybody has access to curative care and diagnostic advice around mental health care. And so we do a SaaS model. We effectively put a software suite in your practice and you upload via the cloud EEG data. We send it back to you with reports and interesting diagrams, and then we can load your TMS device with a protocol specific for that patient. But our entire model is a SaaS model where we have global reach without really, we're based out of Newport Beach, California. And yeah, it's the uptake of this. Formula One drivers are using it for performance. We're seeing athletes use it. Professional sports teams have it in their locker rooms.
But where would these clinics be, and what would be your target audience? Would it need to be a psychiatrist? Does it need to be a medical?
Don't shoot me. Don't record this, and don't publish this, please. But our target audience is a physician who cares about treating their patient holistically and wants to provide more curative care to them. Historically, that's been psychiatrists, but I think the future will be primary care and neurologists. And tools like ours and some of the others that I've heard here will give them the ability to confidently access those markets and provide quite curative treatments.
All right, so you're not interested really in the wellness aspect or potential?
I'm interested in wellness. Big payers and markets are not interested in wellness. And wellness to me is a derivative of doing something extraordinarily well with clinical standards that are incredibly high.
Understood.
Yeah.
Understood. But, the different, well, you mentioned some of the magnetic stim companies, obviously that's a model that's going after psychiatric practice. They built a good economic argument for, hey, look, you spend $70,000 to buy this, you'll cost justify it, within 2 years or whatever. Other companies like Cereset, are you familiar with them?
Yeah.
Started out as brain state technologies, right? And so they thought, okay, well, we're going to go the clinical route, and they have a relationship with Wake Forest University. But then they said, well, we'll also have a home device. So there's like a parallel path. And, I think we've talked about this over the years.
Yeah.
Is it feasible to have one foot in the consumer and one foot in the medical FDA market side of the market?
My commercial expertise has focused on one thing, do it very, very well, and the other things will come to you. If you focus on multiple things at the same time, you're probably going to dilute your outcomes, and typically you run into some very large funding problems through that. I would say with our technology, we have an in-home technology. You notice I didn't speak about it. It's called Sonal. It's a light TMS light unit, 1/100 of the power of TMS. It's guided by the same EEG principles. That's a down the road thing. I think with us, it's really perfecting the use of TMS and then bringing innovation, excitement, and dollars to the TMS market so we can reinvent TMS and make it, instead of a $70,000 device, make it a $20,000 desktop device that's lighter, quicker, faster, and only works the parameters necessary to get people treatment.
Got it. Well, I think you answered that question. All right. Any other questions for Fred? All right. Well, thank you very much.